diagnosed with congestive heart failure, and you talk to your doctor, you may want to consider this approach. But this has been very, very effective. And when I say very effective, I started patients with one patient that comes to mind. She was given up for hospice, and she was on a millinone pump. I put on this protocol in the hospital. We got out of the hospital in about 7 days with this protocol. They drink only green smoothies for the first 7 to 15 days. Only. As the key word is only. Not green smoothies plus chicken wings. Green smoothies only. It's called a green smoothie detox. The patients advanced to smoothies and salads for another 15 to 30 days. They can continue raw foods for another 30 days or add steamed veggies or veggie soups depending on the progress. They can go back to raw foods if they become symptomatic after adding some of the cooked foods. So the green smoothie detox will aggressively detox the body. It drives down inflammation very quickly. The patient can start feeling much better in a very short period of time. If you're doing this on your own, make sure you consult with your doctor. Make sure they're helping you with weaning your medications because we progressively wean our patients from the medications during this detox. So what are the ingredients of the green smoothie? The key ingredients. One, we recommend people using coconut water, or you can use a cold pressed juice. You can use cucumber water, that's fresh juice, or some kind of plant-derived water. Make sure the coconut water is not one of these processed coconut waters. Make sure it comes from the coconut shell. If you can't find good coconut water, get a cucumber and juice it, or some celery and juice it and make that your water base. You can use spinach chopped up, kale. One key is the blue-green algae we use. We get our blue-green algae from E3 Live. E3live.com is where you can find it. We use a barley grass, just need some freeze-dried. So these are superfoods that gives it lots of nutrients, and it helps the body work more effectively at the cellular level. Fresh frozen fruit at your choice, mangoes, pineapple. Use fresh fruit and freeze it yourself, or fresh fruit that's frozen. Or you use pre-soaked dates. They can all be very healthy. So why are green smoothies as effective as they are? Well, heart failure patients have poor gastric absorption oftentimes. You get heart failure, your gut is inflamed and swollen, so you're not absorbing your medication, you're not absorbing your food, and so the smoothie is more easily absorbed, doesn't require as much energy to break down as solid food. So you give your body a rest from a digestive standpoint, less work or digestion in the GI tract, the body can circulate blood to other places that are needed. So the bowel edema is a problem. There's decreased perfusion in the GI tract. So if you're going with a smoothie, your GI tract doesn't have to work as hard. You don't need as much perfusion. Oftentimes you have a damage in what's called the microvilli of the GI tract. So absorption is decreased. So something that's more easily absorbed like a smoothie gives you an advantage. And when you have these fresh greens, you're feeding the healthy microbiome, because typically you have a disrupted microbiome. So it helps repair or replenish healthy gut flora. It's nutrient-rich, pre-digested raw foods. So the nutrient-rich, notice I emphasize the algae and grasses. Those are very powerful foods. They're rich with lots of nutrients. Again, they're more easily absorbed, and it provides for better intracellular hydration. Hydration needs to be inside the cells so the cells function more effectively. And again, we talked about enhancing GI microbiome, and again, less metabolic demand on the GI tract. So it's less work of digestion. So these green smoothie detoxes allow the body to rest from a digestion standpoint, but the body's being hydrated and nourished, and so you're getting the best of both worlds. So it allows the inflammation to be reduced, and the heart starts to function normally. So you can defeat heart failure. Don't let it get your spirits down if you've been diagnosed with this. This is a disease. I've treated many patients who's knocking on death's door, and many of them turn around in a relatively short period of time with an aggressive nutritional intervention. So I hope you got a lot out of this. This is an approach that we've used for quite some time in our practice, and we've had great success. So I hope this finds you doing well. And if you like this, please give us a thumbs up. If you haven't been to the channel, please subscribe. You get more helpful information like this. And of course, please share this valuable information to loved ones or friends who may have had this very unfortunate diagnosis. But until next time, you guys take care. Look forward to seeing you on the next show.